Apollo Cancer Conclave. I welcome all of you for this press conference, and I also welcome our international faculty and national faculty for this. I request Dr. Vijayanand Reddy to come and actually explain about this conference and about what we are doing from tomorrow, and then we'll go for this robotic work. Dr. Vijayanand Reddy. You do it from there.
Very good afternoon and a warm welcome to all of you, and thank you very much for being here. And most of you are familiar with this meeting, which has been happening since 2003. This is the 8th edition of Cancer CI, which we do it biennially. So once in 2 years we do this program. We are all aware of it. The main goal of this conference is to get an update of what's happening around the world, to help the local physicians and clinicians, and to see how best that we can implement what's happening across the globe for the benefit of our patients. And also to socialize and to network with the people around the globe so that we can continue our clinical practice, clinical research, collaboration from various masters in this field of oncology. So keeping that as a goal, we have been doing this every 2 years, and this is the 8th edition of Cancer CI, which is now also called as Apollo Cancer Conclave. And this is the 5th edition of Apollo Cancer Conclave. Every 2 years it's gaining momentum, which basically started with 800 delegates in the past. Now we have crossed 3,700 delegates, and we had to stop the registrations. It has become one of the most sought after cancer congress in this country, and we have 60 plus international faculty, top-notch international faculty who have come here on our request, and more than 600 national faculty, again the top-notch national faculty who are doing subspecialty and more focused oncological practice in our country. Apart from that, we have delegates coming from every corner of this country and also from the neighboring countries. It's so gratifying to see more than 200 people coming from across the country, outside the country as well. Now we have an excellent team of doctors and international specialists who have been here for the next 3 days in the deliberations. Are going to participate in the discussions. Now, as we have only 3 people who had come yesterday, so we requested them to be here. We have Dr. Stephen, who is an authority in immunotherapy, so he would be ready to take up any questions from you. And we have Stephen Lee, who is a specialist in thoracic oncology, anything related to cancers in the chest. And we have a special guest from Japan, Dr. Sangeeta. She is in charge of the new things, what is happening in radiation field, heavy particle radiation therapy, flash radiotherapy, all kinds of new stuff which is coming into radiation. She is doing a lot of research, and she will be ready to answer and take up any questions. Now we have our senior faculty, Dr. S.S. Prasad, senior medical oncologist, Dr. Chinnababu, consultant surgical and robotic surgeon, Dr. Vamshi Krishna, who is in charge of the scientific sessions, is going to brief you about the scientific program, what's happening for the next 2 days. Dr. Sayan Pal is going to talk about the radiation details that we are going to discuss in this meeting. And yeah, so to cut it short, I think that's what I wanted to say, but I'll hand over the mic to Dr. Stephen first to talk briefly on the immunotherapy, what's happening in immunotherapy front.
Thank you. And thank you for the kind introduction. Thank you for the invitation. I think it's the fourth time at the Apollo Conclave I have been. I would like to tell you a couple of things before I will answer your question. So first of all, I really, really like to come to India again and again and again. I have been here. And the reasons are manifold. First of all, the people. I always have the most warmest welcome here and feel in the meanwhile almost like home. And many of my oncology partners and colleagues became friends. And I meet them again at ASCO meetings, at European meetings, American meetings, and of course here in India. Apart from the people, the beauty about this country is quite astounding. Many Westerners don't know it because they visit only the big cities. I've been privileged to see some of the treasures of your subcontinent, a huge, huge country, including God's own country, including Ambi Valley, including, of course, Jaipur and other areas that are outside of the big cities. And apart from the fact that my friends, colleagues, and oncologists, most of them are either trained in the US, in Canada, in the UK or Europe, and if not, they are trained in the best institutions of this country, like Tata Hospital and many others. So the standards here are quite astounding, and I hate to use the word low and middle income countries, because this is what people like to call it. This is a top-notch country in science and in medicine, I can tell you. Now, last but not least, I come for the food. So the diversity of Indian food and the taste is just phenomenal. And even a simple brunch or lunch like today, the tastes are just wonderful.
Thank you so much.
So immunotherapy, what is it? So since about 2,000 years or so, we have, and actually more, we have some historical pictures from patients who had weird growth in their bodies, tumors, which were surgically removed. But it was not until about 110 years ago when surgery became the mainstay of cancer treatment. Later, in 1953, the institution that I trained in Toronto, Princess Margaret Hospital, they used radiation therapy for or against cancer. And of course, the World War II had one good thing. The nitrogen mustard became, in the right dose, actually L-PAM or melphalan, one of the first drugs against cancer. So what we have done in the last 20, 30 years or so, identified also targets, molecular targets, and we developed drugs against these targets. So what did we do over the last 2,000 years? We did do some treatments against cancer. Now, immunotherapy is completely different. What we do, we understand our immune system and work to activate our immune system so the patient's own immune system will kill the cancer. So we are not doing anything against cancer. We're doing only to reactivate and highly successfully the immune system of the patient. Now, it has its problems, and we will hear quite a bit in some of the lectures. For example, not every tumor responds to immunotherapy. We call it is not immunogenic. And there are many reasons why it's so. But some of them are highly immunogenic, and this is where it started with melanoma and lung cancer. So we'll hear more from our colleague, Dr. Steve. The major difference in outcomes for patients treated with immunotherapy is that there is a small but significant number of patients who usually would die, who now are surviving 5, 8, 10, 12 years. We have not seen this before in melanoma stage 4 and lung cancer stage 4. Nobody survived 10 years. So this is unbelievable, and we have 10, 15, and in combination even 20 or 30%, almost 50% surviving years after. So we're starting to think about curing cancer. I believe we can cautiously say it. And that's the fundamental difference between chemo, radiation, targeted, surgical therapy, and so on and so forth.
Wonderful. Steve, would you talk about the thoracic oncology updates briefly?
Sure. So I think Dr. Clark already kind of alluded to, I think immunotherapy has really changed the field of thoracic oncology. I think just really, because it's fairly recent history, because just about, you can say about even 5, let's say even a decade, but prior to that, for decades before that, we were treating patients essentially very similarly. Every patient gets the same treatment. But we know actually not all patients are alike. I think it's really just in the 2000s we started learning about the molecular subtypes of lung cancer. And now really we know each patient's molecular genetic profile and really targeting each of the patients of lung cancer with different drugs that are specifically geared towards their molecular subtype. But then that includes immunotherapy. I think immunotherapy is really enhancing the cure rates for lung cancer. And it's one of the poster childs, if you think about poster childs of in terms of curing patients even stage 4 disease. We dare to say that now because patients are, like Dr. Gluck said, there's this kind of tail, even patient with stage 4 that before you would never see 2 to 3% 5-year survivors, now you're seeing 10 to 15% 5-year survivors, even a patient with stage 4. It's because we understand that actually these patients' tumor are reactive when you're actually you're activating their immune system by able to intervening and blocking certain molecules that in the tumor in themselves. But then I think importantly, not just the drug itself, which of course is very important to help enhance cures, but I think that would lead to Dr. Sangeeta's talk about radiation therapy. One of the most primary importance of treatment of the chest is because is how you approach the treatment with local treatment and also systemic therapy. So it's really a multimodality approach for curing these patients. There are vital organs, right, like any parts of the body, but the heart and lungs are critical, and how you approach the treatment of the cancer can not only improve the efficacy, but also reducing the toxicity, and both go hand in hand to really help enhance cure rates for these patients. So I think this is a good segue into some of the advances in radiation that are very, very important to really kind of improve the cure rate by reducing toxicity for patients.
Yeah, she's Dr. Sangeeta from Japan, and she's doing a lot of research work in the field of the heavy ion particles, which we normally use X-rays for radiation treatment, but there's so much of innovation and research is going on in the field of radiation with heavy particle ion therapy. So she's going to briefly tell you what's new in the field of radiation oncology, and also if you can put some light on the flash radiotherapy as well.
Thank you and good afternoon everyone. So the institute where I'm coming from in Japan, we have a specialized radiotherapy facility which is called carbon ion facility, and that is present only in limited centers in the world. It's around 13 centers in total across the globe now. So the beauty of heavy ion or carbon ion therapy is that we have treated some patients who have such huge diseases which cannot be operated and which do not respond well to normal conventional radiotherapy, and otherwise we would just send them home for supportive care. But we have if we use that heavy ion therapy, they have shown excellent response and their tumors have disappeared. So this is a very strong weapon that we have against malignancy. And so in the last couple of years that I have spent in Japan, which is one of the pioneers in heavy ion therapy, So I have seen so many exciting things, and then I have got experience of how to treat patients with heavy irons. And I think this was a good platform for me to share all those exciting things and clinical experiences with all the oncologists from different parts of the country as well as from different parts of the world. And also in our hospital we do heavy iron together with immunotherapy, which the previous speakers have already explained. So that is also a very exciting area, and I think we feel like if we can gain more experience and if we can explore more, maybe in future we can cure all patients. So it was very nice to share those things with. And flash radiotherapy is also actually in our center we have not yet started, but there is so much research going on, and another center has already started which I have visited. So it's flash radiotherapy is normally we use radiotherapy small dose per fraction, and in that flash radiotherapy we can use very high dose per fraction and very short, very speed delivery. And interestingly, by doing that we can increase the effect to the tumor, and we can decrease the effect to the normal tissues, and then we can reduce the side effects. So that's very helpful for a patient. We can cure tumors without damaging the normal tissues much. So these are very much, they are fields which need more exploration, and probably the rate of cure of cancer will increase. So this was a good platform, this conference is a good platform to exchange our ideas and experiences regarding all those things. Thank you.
Thank you, Sangeeta. I now ask Prasad Garu if you can tell in the Telugu local language for them to understand what's happening in the medical oncology front.
Yeah. ఇప్పుడు మీరంతా విన్నారు ఈ ఫారిన్ స్పీకర్స్, ఫారిన్ నుంచి వచ్చిన డాక్టర్లు అందరూ మాట్లాడగా, ఎస్పెషల్లీ